Distinguished Chair Blackburn and honored members of the panel, thank you for the opportunity to offer my testimony in defense of infant lives, and specifically in opposition to research using fetal tissue derived from induced abortions. As background, I was trained in the disciplines of engineering and medicine, receiving a PhD in the medical engineering jointly awarded by Harvard University and Massachusetts Institute of Technology. I am currently a professor of radiology and biophysics, serving as vice chair of radiology research at the Medical College of Wisconsin. I have participated in medical research for nearly 25 years. I have served on grant review panels for the National Institutes of Health for nearly 15 years, including a 4-year term on the Developmental Therapeutics Study section. I serve on national advisory committees for clinical trials and have founded 2 startup companies. Most importantly, I'm a wife and a mother. The views expressed are my own and do not represent the official views of the Medical College of Wisconsin. I am firmly opposed to research using fetal or embryonic tissue from induced abortions or procedures such as in vitro fertilization. I am compelled to create awareness amongst the community and my colleagues as to why the use of such tissue is both unethical and unnecessary. Let me begin by defining terms. The terms embryo, fetus, baby, or infant each refer to different stages in the continuum of the developing child. When cells are extracted during the earliest stages, these are typically human embryonic stem cells, which are obtained by destruction of the human embryo. When I speak of fetal tissue research, I am referring to cells, tissues, or organs that are harvested from an aborted fetus. While this is the focus of my testimony, my arguments apply to the continuum of the developing child. Proponents of research using fetal tissue make several claims. The first claim is that without fetal tissue, many of the life-saving treatments we have today would not have been possible. Second, it is argued that without continued access to fetal tissue, we are preventing the discovery of new therapies. And third, it is alleged that proper ethical guidelines are already in place to avoid the connection between abortion and fetal tissue research. I will speak to each of these claims. First, it needs to be made clear that there are no current medical treatments today that have required use of fetal tissues for their discovery or development. While the often cited polio vaccine was developed using fetal tissue cells, the developers later testified that initial studies were also successful using cells that were not of fetal origin. Though most vaccines today offer ethical alternatives, not all are available in the U.S., and some, such as chickenpox and hepatitis A, currently do not have ethical alternatives. Yet let me make it clear, there have never been a scientific reason requiring fetal cell lines for vaccine development. Testimony given to the FDA dated May 16, 2001 underscores this point. The developer of 2 common fetal cell lines, HEC-293, human embryonic kidney, and PER-C6, isolated retina from a fetus, stated that his motivation for developing these cell lines from aborted fetuses was simply to see if it could be done, in comparison to what had already been done with animal cells. Since then, use of these cell lines has become widespread, and the manufacturers have no motivation to invest the time or money necessary to produce ethical replacements. Due to lack of transparency, scientists can unknowingly become entrenched in using these cell lines. For example, the HEC-293 cell line is often offered as part of a standard kit available from biotechnology companies and branded under various names. Only upon specific request are alternatives provided. This lack of transparency is devastating for scientists who have ethical objections to use of this tissue and amounts to moral coercion. Second, I refute the claim that without continued access to fetal tissue, the discovery of new therapies will be prevented. The evidence is overwhelming to the contrary. For example, insulin for diabetes is produced in bacteria. Chinese hamster ovary cells have been used for the development of Herceptin for breast cancer and TPA for heart attack and stroke. There are more than 70 successful treatments developed using adult stem cell sources. Over 1 million bone marrow transplants, which are essentially adult stem cell transplants, have been performed to date. Still, some continue to claim that fetal cells unequivocally provide the best option because they divide rapidly, adapt to new environments easily. But alternative tissue and cell sources are available for research without ethical concerns and are demonstrating more versatility than originally thought. Examples include stem cells from bone marrow, circulating blood, umbilical cord, and amniotic fluid, as well as induced pluripotent stem cells and even neural stem cells from cadavers. Adult stem cells have already been used for the development of new treatments, have been proven in clinical trials, and resulted in the formation of new companies, which have successfully brought to market treatments that are routinely benefiting patients today. There is still no viable medical use for embryonic stem cells. Yet the argument continues that keeping this avenue of research open may someday offer the only hope for a child with a devastating disease or a person with spinal cord injury. In 1997, in the New York Times, it was reported that the nation's first transplant of fetal tissue into a person with spinal cord injury. The study required 5 to 8 fetal spinal cords for each adult recipient, but showed no significant therapeutic benefit. Many more studies followed, with none showing significant therapeutic benefit, yet with each continuing to claim great promise. The promise without benefit continues today at the cost of many human lives. So let me address this claim from another perspective. Consider the possibility that a treatment is discovered using fetal tissue transplants, and it is the only option for a certain disease. Consider just one disease like Parkinson's, which affects up to 1 million people in the U.S. alone. Based on a clinical trial in Sweden, cells from at least 3 to 4 fetuses are needed to treat each Parkinson's patient. So 4 million babies would need to be aborted to treat this one disease, not to mention the number needed to treat patients worldwide. Imagine the magnitude of the demand for fetuses to cure yet another disease like Alzheimer's, which affects 44 million people worldwide. Do we really want a world where the most vulnerable, those with no voice, are subject to the whims, desired, and perceived needs of others? Clearly, we will have created industrialized harvesting of preborn babies, a crime against the human race. Third, the repeated assurances that proper ethical guidelines are in place to avoid the connection between abortion and subsequent research are entirely inadequate. By purchasing fetal tissue products, the researcher is not far removed from the act of abortion. As recently described in the journal Nature, one researcher continues to pay $830 for each fetal liver sample, a purchase he must repeatedly make. A few years ago, before the recent media coverage, it was quite easy to go to the website of a biotechnology company and put almost any fetal body part in one's shopping cart and submit for a purchase. So independent of whether a researcher is at the bedside of the one choosing an abortion or using a fetal cell line created decades prior, by purchasing these fetal tissue products, scientists are helping to create a market that drives the abortion biotechnology
Dr. Schmainda,
industry
please
complex.
wrap up. Your time has expired.
So finally, I conclude with what is first and foremost. Each and every human life is sacred, with a fundamental dignity that does not depend on his or her developmental stage or abilities. This value belongs to all without distinction from the first moment of existence. Each and every human life is unique and unrepeatable, created by our loving God in His image and likeness. Nothing, no person, no argument, not even a scientific discovery or cure can diminish the fact that using human embryos or fetuses as objects or means of experimentation constitutes an assault against the dignity of human beings who have a right to the same respect owed to every person. Thank you.